you're not allowed to sell it, that's because people shouldn't be taking it, Dr. Leyla Hannbeck.
Well, we've been asked that, you know, these products should be taken off the shelves. So, but some people may have it in their homes from, you know, previous purchases from the pharmacy. But the risk to people taking Folcodine is small. But as Dr. Hiri was saying, I mean, if they're about to go to surgery, it's very important that they speak to the pharmacist or healthcare professional.
So, okay, so I'm a punter and I'm going to come in to speak to my pharmacist.
Yeah.
I've seen this guidance. I've got a bottle of Day Nurse at home, which I bought from you 3 months ago. I've got a bit of a cough. Should I take it?
I would ask you to, you know, there are loads of other alternatives available.
No, I bought this one. Should I take this one?
Well, it's better, but as a pharmacist I can't do this because obviously we've been asked to take this off the shelves and, you know, recall this, but that is what we need to do for patient safety. I would tell you, please, there are other alternatives, Mr. Edwall. You can take other medicines available.
So the advice that we should ask our pharmacist is all very well, but the pharmacist isn't going to tell me don't take it, Dr. Hiri.
The pharmacist might well say, look, I've been given this advice and I have to say there are safer alternatives. There's always safer alternatives. Having, you know, if you've invested money in your cough medicine, you've got a cough today, you're not likely to have a general anaesthetic in the near future, I would say use it. That's what I would say. As a doctor, I would certainly take it if I had a dry cough. Having said that, yeah, if you're worried about this risk, having had it explained to you, then don't take it. It's a personal choice if you've already got some, but you're not going to be able to get any more from the pharmacist in the near future.
Okay.
I think I might just decide for precautionary reasons, given the risk is very small, but actually, you know, it's been sitting around in my cupboard for 5 years and it's probably out of date. I think I might just throw it away and buy a new one.
As I say,
buy one which is
it's been around.
Okay.
It's been around 70 years. Most doctors have never seen this anaphylaxis in their lifetime.
Interesting. So the medicines being recalled: Boots night cough relief oral solution, Boots dry cough syrup, 6 years plus, Boots day cold and flu relief oral solution, cough said Linctus. There's a huge number of them. Just, Dr. Leyla, just to point out, night nurse is very common. It isn't actually on the list, except when it's part of day and night nurse tablets, which are sold together.
Yes.
Is that right?
Yes. It's just that substance Folcodine.
Yes. Which
in the
isn't in night nurse, am I right?
Yeah,
Night nurse,
in the liquids, yeah.
Okay.
I'm going to go over and see if I've got night nurse rather than day nurse, because then I'll be all right.
Dr. Henry, I just want to ask, we are, as Kevin mentioned, we are in the 3rd day of the junior doctors' strike. Do you think it's been effective? Do you think that the budget might produce something for either doctors or nurses? Have you seen an impact on patients? Do you think that people are avoiding going to see either their doctor or A&E right now because of it?
Absolutely. Lots of outpatients appointments have been cancelled, operations have been cancelled. It's created an even greater backlog after the pandemic of people waiting for procedures. And it's the system has been held up by consultants and specialists standing in for those junior doctors. But yeah, people are in corridors. You know, a lot of people don't realise there's a strike going on and that they're waiting in queues, in corridors and A&E departments. So it has had an impact, and I do hope that this gets resolved, because it's the fundamental foundation of the NHS crisis. If we don't retain doctors, if doctors say we can't live like this with the fees that we earn in the first few years of being a doctor, then our NHS will collapse. So it's a serious crisis.
Dr. Leyla Hannbeck, sometimes in these situations, more people go to their pharmacist because we're told that's the place to get sort of the first bit of information about your illness. Do you see extra pressure, and can pharmacies cope in situations like strike?
Oh, Susanna, it's honestly at the moment we're under a lot of pressure, and it's very difficult for pharmacists because the NHS keeps pushing more and more people toward pharmacies for various different reasons to seek advice. But the funding that we've had has been reduced, and it doesn't take into account any of the inflation rates or anything else. And so pharmacists are absolutely down at the moment from all angles, from workforce pressures to funding to everything else. So this system is not sustainable. So we cannot keep pushing more and more pressure on pharmacists when there are strikes happening elsewhere within the NHS.
Good day to make that point.
Absolutely right. Yeah, thank you both very much indeed.
Thank you.
campaigning in the Mail for more money for pharmacies because so many pharmacies, particularly community ones, are closing down, and they're such an important prop.
It's amazing. This Daily Mail these days.
You should have read it.
More money for pharmacists.
Socialist Daily
Cut
Mail.
the corporation tax.
We support
cut the taxes.
We want
spend more. I tell
we
you,
want better
it's
primary
spend
care.
with you. Andrew.
What do we
Except
want?
when it's
More
spent stuff-
spending.
no,
What do
no.
we want? Lower tax.
It's a
Hang
very,
on.
it's a very good campaign on
See.
pharmacies, and I
Yeah.
reckon again there might be
Do
something
you know
about
what?
that.
My local pharmacist worth his weight in gold.
Absolutely.
Absolutely.
Right, yeah.
The
Definitely.
pharmacist looks after my 97-year-old mother.
Yeah.
Worth their weight in gold, absolutely.
Yeah.
But they've got queues outside the
Yeah.
shop. They're absolutely snowed under,
Yeah.
and we're piling more and more work on
Well,
them as well.
Huge appreciation here
Thank
for
you,
them.
thank you.
Thank you all very much indeed.